So our next presenter is Nick Jacobson. Nick is an assistant professor in the departments of biomedical data science and psychiatry within the Center for Technology and Behavioral Health in the Geisel School of Medicine at Dartmouth. He directs the AI and Mental Health Innovation in Technology-Guided Healthcare Lab. His research uses technology to enhance both the assessment and treatment of anxiety and depression through longitudinal data acquisition, passive sensing with smartphones and wearables, and providing scalable, personalized technology-based treatments using smartphones. To date, Nick's smartphone applications have been downloaded and installed by more than 50,000 people in over 100 countries. So he's going to tell us today about taking these same kinds of approaches across multiple timescales from multiple measurements within the same day on an individual out to following individuals over decades. So with that, Nick, please take it away.
All right, thanks, Justin, and thanks everyone for coming to this during these trying times. And I am glad that technology is making all of this possible. I appreciate everyone for organizing this. It's a great effort. So today, as Justin mentioned, I'm going to be talking about using passive sensor data collected from smartphones and wearable sensors to try to predict psychopathology across multiple timescales. Let's see. There we go. It did work. All right, great. I do want to acknowledge that this work is funded from the National Institute of Mental Health with the recent R01, and I'm excited to be taking some of these studies forward. So today, just an overview of what I'm going to be talking about. I'll talk about a little bit of an overview of passive sensing, predicting static outcomes, long-term changes, and then short-term changes. So what is passive sensing? So passive sensing, also discussed as digital phenotyping, is a way of trying to predict and quantify psychopathology and related states or healthcare or health states more broadly. These are some examples of some of the types of sensors that I use pretty regularly. So things like heart rate, sleep, and vocal tone, microphone, sound quality and location, social proximity and conversations, things like facial features and detection, outdoor light, things like this. Movement is a big one. So I'm going to talk about using these types of data to try to predict static outcomes. When I talk about static outcomes, what I mean, and the relatively broad goal of this work, is to try to identify something that is a trait-based difference, something that is fixed, that is at least within the data, unchanging. And the main utility of an approach like this might be to try to identify those who need treatment. So some of this work, as an example, we've tried to predict a static outcome. So say whether someone has a mood disorder or not. So among folks with bipolar or depression, trying to differentiate those folks from non-depressed controls. And you can see with some machine learning models based on some wearable movement data within the context of daily life, we could predict and differentiate folks who had either bipolar or major depressive disorder from those who are these non-disordered controls with a pretty decent accuracy. You can see our hit rates are on the little blue guys, and our red guys are our miss rates. So you can see we're not perfect, but we're doing pretty darn well with just a single type of sensor, movement in particular. So in this case, movement is really, we think, reflective of a major hallmark symptom of major depressive disorder, namely psychomotor retardation. We've also used to go outside of kind of the diagnostic structure and try to predict symptom severity across many different things. Here I've got major depressive symptoms on the left, reflected by the BDI. We've also predicted this with clinical interviews and things like this, and shown pretty strong concordance. So pretty strong concordance between self-reported symptoms and clinically interviewed symptoms of major depression and movement patterns from wearable sensors. And then also used smartphones to try to detecting movement, incoming and outgoing calls and text, to try to assess whether the degree to which someone has the degree of severity of their social anxiety symptoms. And with this, you might expect things like incoming and outgoing calls to be particularly strong predictors of social anxiety. In particular, because they could actually encapsulate social avoidance through technology-enabled media or connections. Again, when we've done these studies, movement again appears to be a very strong predictor in this setting as well. So also movement seemed to carry the day in these works, and I can talk about some of the patterns that we were finding in a bit if we have time. So we've also tried to do this with something that is really thought to be a very internal state. Pain in folks who are living with HIV. And so pain is thought to be this completely subjective internal experience. There have been debates about whether you should have or be able to have biomarkers of pain because of this inherently subjective experience. So, the gold standard rating for pain and is implemented in the doctor's offices that you probably visit, and you will maybe get asked about a pain rating scale, and it's usually on a 0 to 10 or something along those lines. And well, we wanted to see if we could actually pick up on something that might be, even though it's a subjective component, some kind of objective manifestation of those subjective complaints. And so we tried to look again at movement patterns from wearable sensor data collected across, I think, a week or two in predicting folks' level of pain among these folks with HIV. We also did this with worry among the same population. And again, it's about half of the variation and total symptom variation and pain there. We've done this with generalized anxiety disorder symptoms and can differentiate those with elevated symptoms of generalized anxiety disorders from those without, with a pretty strong predictive performance. So an AUC of about 0.89. We've started trying to better tease this out. So what are we actually capturing in terms of what kinds of GAD symptoms are we trying to do? Are we able to do this with movement sensors? And some of the things that we're predicting with these risk scores seem to really be tapping into restlessness, irritability, feeling like you're out of your mind, and then controllability of worry, with less ability to predict GAD duration or the number of worries that people are having. So those were static outcomes. Though everything I was talking about were predicting something that was just fixed in time, and I have all of these time series data collected from streams of data related to their wearables or their smartphones, and trying to predict symptoms at one time point. We've also tried to see if we can predict changes of related psychopathology states across time. And I'm going to talk now about predicting long-term changes. So when I say long-term, this may sound like a short-term change to some, but I guess it's all relative. This is trying to predict major depressive disorder symptom severity of some folks who are in treatment for depression. And so some of them were in an inpatient, a small amount of folks were in an inpatient group, and then most of them were in outpatient settings, trying to predict the degree to which they changed across time in their major depressive symptoms. So overall, we could predict the majority of the variation in their symptom changes using, again, wearable movement data. This one was something that we've been really interested in, is how far out can we go? And so we recently have tried to predict across a very large time scale, trying to predict symptom deterioration and generalized anxiety disorder and panic disorder symptoms. So people who had an increase in generalized anxiety disorder symptoms and panic disorder symptoms across 17 to 18 years. With essentially this passive sensing that was occurring with wearable movement sensor again, occurring in between about 9 years into this. And so we're trying to, again, predict out symptom deterioration, so people who would have an exacerbation of their symptoms. And in some ways, it's good, and in some ways it's bad. So you can see the AUC here. If you are used to doing cross-sectional data, or you're used to a different setting where you have a lot of control, this AUC looks terrible. But framed within the complexity of this problem space, where we're trying to predict out of sample performance of 265 people and differentiate those who are going to increase or decrease across such a large time span with something with no active data collection, we're actually very impressed. When you compare this with self-report symptoms, where we're actually assessing the symptoms themselves occurring at an earlier period, this outperforms those this kind of within this setting. So we can predict with about 84 to 85% sensitivity and about 53% specificity who is actually going to have an increase in their generalized anxiety disorder and panic disorder symptoms based on movement alone. And we think that this might be a really important game changer in actually trying to provide prevention efforts that are a little more targeted, so that we really are getting it to the folks who need it most. Okay, so great. You can predict pretty far out with above chance. Can we do this within a shorter term setting? Well, I've designed an application called Mood Triggers that can assess anxiety and depression symptoms via ecological momentary assessments and related symptoms, and then also can do things like a heart rate assessment and many other passive sensing data features. It also will give folks personalized, tailored feedback about what their maintenance factors of their anxiety and depressive symptoms across time, and it uses that as an intervention. I've collected folks have used this application and participated in research across the globe. So about 11,000 people in over 100 countries have participated in this research and used this application within their daily lives. I've used this application to assess many different things via passive sensing data and tried to predict depression symptom changes and used ideographically weighted machine learning models, which are essentially trying to predict on the individual, use the individual as the major focus of prediction while still allowing the group trends to inform the predictions when the individual is kind of weak, when their data isn't really strongly indicating one signal or another. And you can see the individual predictions for each individual across time in this study. And so this is a folks who were at clinical levels of depression, and we predicted their depression symptom severity changes across time. And these are across hour-to-hour changes, so really small micro changes, trying to predict how fast these fast-term changes in their depressive symptoms. And you can see that we're doing pretty darn well. Generally, for about, we could do this with most everyone. We could predict significantly. There was one person we couldn't predict significantly above chance, but everybody was we could generally predict these fast depressive symptom changes. You might be wondering, so okay, you've got all this data. What's like driving some of the predictions? And I guess I've hinted at movement and things like that being some of the things that carry the day in some situations. We've done this within anxiety as well. So outside of depression, so within anxiety, this is just some of these also used personalized deep learning models to try to predict symptom changes in anxiety in a very rapid symptom changes. So again, these ecological momentary assessments that were hour to hour. And so these are folks with generalized anxiety disorder or social anxiety disorder. And there's a lot of location-based features that we do with this kind of geolocation data. We code the weather, we code semantic location, we can code a lot of other things. But being indoors seems to be a pretty big trigger for this particular sample that we were trying to predict. But there's a lot of heterogeneity in that, and generally actually a decent distribution across a number of different features. So what are my take homes away from these kinds of studies? Generally, I think unobtrusive sensor data collected within daily life can be used to accurately assess psychopathology with little burden. that we can predict psychopathology across both very long timescales and very short timescales, and that these all have different potential utility. These passive sensing methods could potentially be used to improve our detection rates, could inform targeted prevention interventions, and then just-in-time adaptive interventions that could adapt in real time to give something that folks need when they need it. I'd like to thank my lab for all of their hard work in making this happen, and thanks everyone for the invitation. I'm looking forward to speaking with folks in a discussion soon.